Hello future nurses confused about electrolyte imbalances. In this video, let's make potassium imbalances, that is hypokalemia and hyperkalemia, clear, including causes, clinical manifestations and management using easy mnemonics so that you never forget. So let's begin. Potassium. Normal level of potassium is 3.5 to 5 milliequivalent per liter. Potassium plays vital role in cell metabolism, cardiac contractility, transition of nerve impulses, function of muscle tissue, and acid-base balance. To remember this, we know that symbol of potassium is K, and from K we have to remember cardiac, that means heart, which means that whenever there will be potassium imbalance, heart symptoms will dominate, ECG changes and cardiac dysrhythmias may occur that can be life threatening. Now, the normal level of potassium is 3.5 to 5 milliequivalent per liter. Two conditions occur when potassium is out of balance: hypokalemia and hyperkalemia. In this video, let's discuss hyperkalemia. Hyperkalemia, serum potassium level exceeds 5 milliequivalent per liter, means potassium level is more than the normal value, that is more than 5 milliequivalent per liter. Let's discuss the causes for hyperkalemia. We know that in hyperkalemia, more potassium is there in the body. That means more potassium is trapped inside the body. So, to remember the causes of hyperkalemia, we have to remember the mnemonic, that is trapped. Means more potassium is trapped, more potassium is there than normal in the body. T. T stands for tissue damage, burns, crush injuries, or hemolysis. In case of any tissue damage because of burn or crush injury or hemolysis, cells are also damaged. And when cells are damaged, potassium will move out from cells into the blood. More potassium is there in the blood, so serum hyperkalemia develops. R. Renal failure. We know that kidneys normally excrete potassium. So if there is any kidney disease, then more potassium will build up in the body because of less excretion of potassium, so hyperkalemia develops. A. Adrenal insufficiency such as Addison's disease. In Addison's disease, there is lack of aldosterone hormone, and aldosterone normally promotes potassium excretion. So if there is lack of aldosterone hormone, then potassium retention occurs. P. P stands for potassium sparing diuretics. If person is taking potassium sparing diuretics including spironolactone, these drugs prevent potassium loss in the urine because more potassium is retained in the body. So hyperkalemia may develop. P. Potassium intake is increased, over ingestion of potassium containing foods, rapid infusion of potassium containing IV fluids. There is increased intake of potassium from diet or overuse of potassium supplements or due to rapid IV potassium infusion. There is increased level of potassium in the body and the condition of hyperkalemia may develop due to this. E stands for excretion impaired. Excretion is also impaired in case of renal failure or if the person is taking some drugs that reduce renal excretion, including ACE inhibitors or NSAIDs, cyclosporine. These drugs also reduce renal potassium excretion. So, more potassium is trapped inside the body, that is, hyperkalemia may develop. D. Dehydration, less fluid, increased potassium concentration. If there is severe dehydration, there is less fluid volume, or we can say less blood volume, and due to which there is increased potassium concentration as compared to the fluid volume. The potassium concentration is more, so hyperkalemia. These are the causes of hyperkalemia, and the mnemonic we have to remember is trapped: tissue damage, renal failure, adrenal insufficiency, potassium sparing diuretics, potassium intake is increased, but excretion impaired, and dehydration. Clinical manifestations. Now we will discuss the sign and symptoms that develops due to hyperkalemia. Mnemonic murder. We know that if there is potassium imbalance, whether increased potassium or decreased potassium, cardiac dysrhythmias develop. And in case of severe hyperkalemia, more potassium in the body, the person may die. So, from that, we have to remember the mnemonic murder in case of hyperkalemia for the clinical manifestations. M stands for muscle cramps and weakness. High potassium will reduce the excitability of muscles, due to which muscle weakness and cramps will occur. Urine abnormalities, oliguria, or renal failure, due to which these will occur. Like if there is renal failure, then potassium excretion is impaired. Urine abnormalities may develop in case of renal failure. R, respiratory failure. Respiratory failure will also occur due to muscle weakness. The person will have difficulty in breathing. D, decreased cardiac contractility, low heart rate, and low BP. If potassium is increased, then myocardial contractility is reduced, and due to decreased myocardial contractility, heart rate also reduced, that is bradycardia occurs, and low BP, hypotension occurs. E stands for ECG changes. Due to hyperkalemia, various ECG changes develop. R, reflexes, hyperreflexia. In case of increased potassium, hyperreflexia is occur because neuromuscular transmission is impaired. So hyperreflexia occurs. So these are the clinical manifestations of hyperkalemia, and we have to remember these from the mnemonic murder: muscle cramps and weakness, urine abnormalities, respiratory failure, decreased cardiac contractility, ECG changes, and reflexes. Let's discuss the ECG changes that occurs in hyperkalemia. Tall peaked T waves, flat P waves, widened QRS complex, and prolonged PR interval. These are the four ECG changes that occurs in condition of hyperkalemia. Tall peaked T waves, flat P waves, widened QRS complex, and prolonged PR interval. This is a normal ECG pattern. We can see the P wave, the QRS complex, the normal T wave, PR interval, QT interval. This is the normal ECG. And this is the ECG in case of hyperkalemia. As we can see, the P wave is flat, the T wave is tall and peaked. So here we can see the changes in the ECGs. In hyperkalemia, there is flat P wave and tall peaked T wave. Also, the QRS complex may be wide in some cases, and the PR interval is prolonged. These are the ECG changes that occur in hyperkalemia, and the mnemonic to remember this is high K tall T, because tall peak T wave is the most common sign of hyperkalemia. So, for that, we have to remember high K tall T. From this mnemonic, we can remember the ECG changes. Let's discuss the management of hyperkalemia. The mnemonic is drop K. We know that there is high potassium. So, what is our management? That we have to drop the potassium level. So, for the mnemonic, we have drop K, that is drop potassium. D, discontinue potassium intake, stop IV or oral potassium supplements and potassium sparing diuretics, or avoid high potassium foods. We have to discontinue, decrease the potassium intake. If the person is taking oral potassium supplements, we have to stop that. We have to stop the IV potassium infusion, potassium sparing diuretics we have to stop, and avoid high potassium foods. Renal function is impaired, administer sodium polystyrene, a cation exchange resin. Sodium polystyrene is a cation exchange resin, and the work of this is that this binds with potassium and excretes potassium. So if renal function is impaired, means kidneys are not able to excrete potassium, then we can administer sodium polystyrene, because sodium polystyrene will bind with potassium and will help to excrete the potassium. So this is a cation exchange resin that can be used in the management of hyperkalemia. O stands for observe ECG changes. We have to observe and monitor cardiac changes. P, protect the heart, IV calcium gluconate. We have to protect the heart because various dysrhythmias, or we can say cardiac changes, are occurring. So we can give IV calcium gluconate to stabilize the cardiac membranes to protect the heart. K stands for potassium increased. We can give sodium bicarbonate in case of acidosis or insulin plus glucose. If potassium is increased, then we can give sodium bicarbonate. Sodium bicarbonate is mainly given if there is condition of acidosis, because sodium bicarbonate will help to move potassium back into the cells. And also we can give insulin plus glucose in case of hyperkalemia, because this combination IV insulin plus glucose also pushes potassium back into the cells. So this is the management for hyperkalemia. Discontinue potassium intake. If renal function is impaired, then administered sodium polystyrene. Observe and monitor ECG changes. Protect the heart with IV calcium gluconate. And if potassium is increased, then give sodium bicarbonate or insulin plus glucose. So this is the management for hyperkalemia. Stay tuned for easy explanation of other electrolytes in upcoming videos with Smart Mnemonics with SmartNurseGuide. Thank you.